Ever open a Med-Surg chapter, see all the bolded terms and feel lost before reading the first line? Key terms are just a small part of the work, but they unlock the rest. If you learn term first, the rest becomes easier to absorb. Hi guys, you might know what the wound looks like, but one single word in question can completely change your answer. Let's break down the key terms that make every wound care question on the NCLEX. This one word changes the whole wound care questions. So let's look on what those words actually mean, because the NCLEX isn't testing how many terms you can memorize, it's testing if you can see the difference between them. So let's go through each term one by one and connect to the what the question is really asking. So now let's go over to the wound care words that can really change on how we answer the question. Chapter 50, Key Terms, Coordinating Care for Patients with Skin Disorders. Mostly it's like how the wound is going to affect the patient, and few words about the cancer. We have 45 terms. Again, it's a long chapter, very heavy chapter. So we start with abrasion, superficial, partial thickens, skin loss caused by friction, so scrape, involves epidermis, very superficial, so the epidermis is very superficial. Dermis, usually minimal bleeding and heals by re-epithelialization. So A means against the surface, so the shape is top layer. So the top layer is affected, that scrap. Actinic keratosis, it's a pre-malignant, rough, scaly macule pimple from chronic sun exposure, risk of progression to squamous cell carcinoma. AK is like almost cancer from sun actinic. Angiogenesis. Oh, I forgot to make these. Angiogenesis is formation of new blood vessel in tissue, normal in healing, exfoliate by tumors. Angio, it's a vessel. Genesis, it's a creation. Bacteremia, it's the presence of bacteria in the bloodstream may lead to sepsis if uncontrolled. So emia, it means in the blood. Basal cell carcinoma, its most common cancer, skin cancer, pearly pimple with telangiectasis and roll border, locally invasive, rarely metastasizes. So basal means base layer cancer, pearly but persistent. Again, we have the Barden scale we had in the previous episode, previous chapter about this more in detail in outline and in NCLEX part. Standardized tool predicting pressure in injury risk across 6 subscale: sensory, moisture, activity, mobility, nutrition, friction, shear. So low score is the higher risk. So we have the cellulitis, acute bacterial infection of dermis, subcutaneous, often streptococci or staphylococcus, diffuse in erythema worth tenderness. So cellulitis is like hot red tender sheet of skin. Then we have the debridement, removal of devitalized tissue, biofilm, autolytic, enzymic, mechanical, conservative, sharp, surgical to stimulate healing. So debridement means to remove debris. Dermatophyte, it's the keratinophilic fungus infecting skin, hair, nails, tinea. So derma means skin, phyte means plant or fungus. Eschar means leathery, dry, black, brown. Narcotic tissue is that super black thing. Thing on the skin. So narcotic tissue over a wound and stable heel eschar often left intact if dry and non-fluctuant. So the eschar is that hard scar cap, and sometimes you just leave it alone. In some cases, I've been seeing you don't remove it. In some cases, need a little bit of surgery, and depending where it's located. So I don't go in detail on that, but on the outline, I will go. Now I'm just moving on. Reaction, linear aerosinosis, caused by scratching or rubbing, loss of superficial epidermis. So it's excoriation. It's like scratch out. And now we just scroll a little bit down, make it nice and pretty. Exudate, fluid from a wound, inflammation, serasanguinos, and purulent. So these four names right here, we know how it looks like, with little blood, pinkish blood, very bloody, and purulent, it's yellowish. That is like the liquid that gets out from a wound. And by knowing these exudate, then you'll know the wound is healing, it's fresh by the trauma, or it's infected. So it's very good to know. Yeah. Then folliculitis, it's the inflammation or infection of hair follicles, small pustule with perifollicular erythema. So follicule, it's that hair fossils, and then etis, it's the suffix for inflamed, like Any word that you know is inflammation has EDs. Conjunctivitis. Fournier gangrene. I will never post a picture about this. You can just type in Google and or any browser you have, Safari or Bing, depends. So if you see, you'll understand more what it means. So it's a polymicrobial narcotic facilities of perineum, genitalia, surgical emergency, high mortality. Actually, when I was an LVN student, I follow one day the wound, not one day, but a few days, and one of the day the wound nurse. I followed the wound nurse, and she had a patient with this, and and I had clinical sites on Fridays, and when I followed the wound care nurse, she had the doctor in, and the doctor, we have the doctor, me as a student, and the nurse, and then the doctor will explain like so nice about the wound, and you can tell that she was so passionate to explain the wound care for specifically this area of the body. So I always remember her as one of the best doctors that will explain and take time to the students during um, um, during visiting a patient. So it was a very good time. Okay, so now we go in full thickness. Tissue loss through epidermis and entire dermis into subcut or deeper. Muscle bone, we know this heals by granulation, contraction, and scarring. So it's like full depth beyond dermis. Here you'll say like 4-stage or unstageable with pressure injuries. Furuncle, so it's the boli, deep folliculitis abscess, usually Staphylococcus aureus, fluctuant, painful nodule. So this furuncle, it's for the boil of that follicle, like where is the hair. Granulation tissue, it's a beefy, red, moist, vascular connective tissue that fills wound during proliferation, bleeds easily. So we know that the granular, it red buds of healing. The herpes simplex virus is the viral infection causing grouped vesicles on epidermatous base, painful, recurs on 1 and 2 for the herpes, genital, so H2, it's genital, and the overlap exists. So it's like hurtful small vesicles. Here we have the herpetic with low. So it's same. It's the herpes infection of the finger, medical dental worker, thumb, suckers. Painful vascular lesion on distal finger. So with low, it's the white fingertip vesicle. And then laceration, we know this traumatic tear cut with irregular edges from blunt penetrating injury may involve deeper structures. The lace, it's the ripped skin edges. The lace, lace. Maceration, it's the softening erosion of skin from prolonged moisture exposure, incontinence, sweat drainage. So the macerate is like marinate in moisture. Oh, I don't want to think marinate. I have some meat in marinade. Oh God. Melanoma, malignant tumor of melanocytes, high metastatic potential, screen with A, B, C, D, E, asymmetry, border color diameter involving. So melanoma, that you when you document, you need to follow the A, B, C, D, E. Tool documentation. So the MRSA, the methicillin resistant Staphylococcus aureus, this is resistant to beta lactams. The methicillins we talk in the chapter for immunity with infections. More about their causes. Skin soft tissue infection requires contact precaution. Again, contact precaution is very important for the NCLEX contact precaution, but also for the nurse safety and the visitors that visit the patient, and target therapy. So just think that MR, like methicillin resistant, is just means resistant. Here we have the sensitive one, like the methicillin sensitive Staphylococcus aureus. So it's susceptible to methicillin, nafcillin, oxacillin, treat with beta lactams when appropriate. So now I'm going to scroll a little bit more down. We're getting there. Mucocutaneous, involving both mucous membranes and skin. So mucous plus cutaneous, it's wet skin. Cutaneous is skin. And then necrotizing fasciitis, rapidly progressive soft tissue infection along fascial plants, severe pain out of proportion, systemic toxicity, urgent debridement plus board antibiotics. So necro, it means dead, fascia eating fast. Then we have neoangiogenesis. It's a new vessel growth in healing with and within tumors support growth metastasis. So the neo means new, like neotal. So neo means new. Plus angiogenesis is the vessel creation. It's like pathophysiology. So if you get a quiz, that it's a perfect word to describe and make a like a essay question type, like a short answer. Onycholysis. So we know lysis is loosen, and onycho, it's a nail. So the separation of nail plate from nail band, trauma, proriasis, on onychomycosis, thyroid disease. The onychomycosis, so the mycosis we know means fungus of the nail, and fungal infection of the nail, thickened, brittle, discolored nail plates requires prolonged therapy. Um, Partial thickness involves epidermis and part of dermis, heals by reepithelialization from wound edges, appendages, minimal scarring. So partial dermis only. Phases of wound healing. So here it's hematasis, inflammation, proliferation, granulation, epithelialization, and remodeling maturization. So to remember, it's like HIPR, hemo, inflam, prof, remodel. Pressure injury, localized damage to skin, underlying tissue over a bony prominence related to pressure, shear, stage 1 to 4, unstageable, deep tissue injuries. So pressure over prominences with stages. Primary and intention, it's wound edges approximated, like sutures, staples, adhesive, minimal tissue loss, and scarring. So it's a low infection risk. So primarily means like almost close. Psoriasis. It's a chronic immune-mediated plaque with silvery scale on extensor surfaces, scalp, or peace sign, triggers trauma, infection, stress. So P is like a plaque with silvery scales that I call it. And see, we have 45, so bear with me. Quantitative tissue biopsy, tissue sampling to quantify bacterial burden. Then we have and guide the therapy. So counts back per gram, that's they call it. Quantity. Secondary intention. Earlier we have primary, now we have secondary. So it's an open wound left to heal by granulation, contraction, re-epithelialization, large scar, higher bioburden risk. So the skin heals second by itself. Shearing forces, it's sliding of skin over deeper tissue, causing vessel kinking, tearing, major pressure injury contributor. So it's like slide down, sheath shear. Skin tear. Skin tear is a very common name. Word, traumatic wound separating epidermis from dermis, so the both layer, common in frail sterile strip, management per ISTAP classification. So it's a paper thin skin tear. Slough, it's non-viable yellow, white, stringy tissue within wound bed, often requires debridement. So slushy slough is like removed to heal. Squamous cell carcinoma is malignancy of keratinocytes, scaly indurate nodule plaque on sun-exposed skin can metastasize. Treat early. So as can be like sun-exposed scaly cancer that can spread. Tele Giantaceae, a fine, visible, dilated superficial vessel like spider veins or red lines, so tele lines on the skin. Tertiary initiation, delayed primary closure after contamination is controlled and granulation begins. This reduces infection risk. So tertiary means third option, delay, then close. So you have primary, secondary, and tertiary. Then you have the cancer cells, which of them they are, and then you need, for the cancer you need to have the A, B, C, D, E, and then for pressure ulcers you need to have the Barden scale, and then a few words of type of skin, like those pumples, how it's cutted, how it looks like. So these the key terms are tinea, it's the dermatophyte infection is named by site, carpitis, carporis. I should know this, I speak Latin. Carpotis, pedis, cruris, unguium. Okay. Annular ring worm with central clearing. So tinea means tin can ring. It's like a ringworm. Tunneling is a channel track extending form wound into subcutaneous tissue or muscle, requires packing and mapping of depth. So it can be like a tunnel tube from the wound, kind of, because it's tunneling tune. And undermining, it's a tissue discretion under track skin at the wound edge, creating a ledge overhang to probe to assess. Oh, I cannot even read. So it's underside missing below the edge. So probe to assess the extent. So underside missing below the edge, kind of like that. And now I will show you a little picture of all cancer types, and then we'll see you in an outline for more detail. I hope you enjoy, and I will see you next time. Today it's October 23rd. 25 and it's 5:43 p.m. when I do this record, and I need to go with my dog Gemma in the park. Maybe I should do a picture with her. For dog lovers. Okay, bye for now.